Come in.
Hello, my name is Ty. I'm a nursing student. I will be doing your head-to-toe physical assessment today. What I'm going to do is wash my hands. Now, when I check your wristband, I want you to state your name and birthday for me, please.
Renee Barnett, March 4th, 1994.
Okay. Now, for the physical assessment, we're going to start from your head all the way to your toes. I'm going to check your scalp first, so I want you to, there is no lesions, depressions, or anything abnormal. Your scalp is clean and moist, so you can look up now. Next, I'm going to check your, if your face is bilaterally symmetrical, which they are. And next, I'm going to palpate your sinuses. I'm going to palpate your maxillary, and I'm going to palpate your frontal sinus. And whenever I palpate them, I want you to tell me whenever you feel any pain or tenderness, okay? Feeling anything?
No.
There?
No.
That's good. Next, I'm going to check your cranial nerve number 7, which is your facial nerve. What I want you to do is smile for me. And puff out your cheeks. Smile. Puff out your cheeks. Good. Your cranial nerve number 7 works properly. Next, I'm going to check your trigeminal nerve, which is your cranial nerve number 5. What I'm going to do is I'm going to take my cotton. I'm going to touch it to your face. I want you to close your eyes and tell me whenever you feel it.
No. 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 No.
Okay, your trigeminal nerve works properly. Next, I'm going to move on to your eyes. I'm going to see your pupils are bilaterally symmetrical, which they are. And next, I'm going to palpate your eyes. I want you to look up, and I'm going to pull down your lower eyelids and check your conjunctiva. Your conjunctiva is pink and moist. Next, I'm going to check your sclera, which is the white part of your eye. And your sclera is white and moist. Okay, now I'm going to test if your pupils constrict. And what I'm going to do is grab my pen light. And I want you to look straight at me while I shine this to your eyes, okay? Pupils constrict. Next, I'm going to have you accommodate, which means I'm going to move my pen. And I want you to move your eyes toward, and follow my pen with your face still towards me, okay? Okay, your eyes accommodate well. So your pupils are equally round, and they react to light, and they accommodate perfectly. And next, I'm going to check your cranial nerve number 2, which is your visual acuity. What we're going to do is check the Snellen chart. I'm going to have you cover one of your eyes and look at the Snellen chart and read the lowest line you can read. And then I'm going to have you cover your other eye and read the lowest line you can read. And unfortunately, we don't have our Snellen chart with us, so we're going to move on to your nose. I'm going to check to see your nose is bilaterally symmetrical to your face and midline to your face, which they are, which it is. And I'm going to check your external nose to see if there is any lesions, depressions, anything abnormal. And there are not, and you have no deviated septum. I want you to flare your nostrils for me. Okay. And next I'm going to check your patency, which means I'm going to plug one of your nostrils while you sniff in through your other nostril, okay? Your other one. Okay, your patency works properly. And next I'm going to check your internal nostrils. I want you to look up. I'm going to check inside with my pen light to see if your mucous membranes are red and moist, which they are. I do not see any abnormalities. You look down now. Okay, next we're going to check your mouth. Your mouth is pink and moist, and there are no crackles. I see nothing abnormal. And I want you to open your mouth for me, please. I want you to lift your tongue and move it side to side. And now I'm going to use my pen light. I'm going to check inside to see if your mucous membranes are red and moist, which they are. I'm going to check your gums. They are red and moist and they have no white spots. And your teeth are straight and white. You can stick your tongue out. The uvula and tonsils are intact and they are symmetrical to your mouth. You can close your mouth now. Okay, next I'm going to check your ears, so I want you to put your hair behind your ears. What I'm going to do is I'm going to palpate your ears to check for any lesions. And whenever I palpate them, do you feel any tenderness at all?
No.
Okay. Good. And I'm going to check inside your ears for any discharge. And there are no discharge. And now I'm going to check your cranial nerve number 8, which is your hearing acuity. What I'm going to do is I'm going to cover one of your ears and I'll whisper to the other ear, and I want you to repeat what I say, okay?
3, 2, 1. 7, 8, 9.
Okay, great. Your cranial nerve number 8 works properly. Next, I'm going to check your neck, so I want you to lift your head up for me, please. I'm going to check to see if your trachea is midline to your body, which it is. I'm going to check your thyroid to see if there is any masses or enlargements, which they are not. Okay, you can lift your head down. I'm going to inspect for carotid bruits. I'm going to use my stethoscope for this, so I want you to lift your head up again. I'm going to listen to your neck on each side. I did not hear any carotid bruits, and if I did, that would indicate stenosis or narrowing of the vessels or blockage. Next, I'm going to check your cranial nerve number 11, which is your spinal accessory nerve. What I'm going to do is push down on your shoulders. I want you to put your shoulders up against my hands. Okay, good. And now I'm going to put my hand against your face. I want you to push against the opposite way. And this side. Okay, your cranial nerve number 11 works properly. Okay, now I'm going to inspect and palpate your thorax area. I'm going to palpate. I'm going to see if your skin color is consistent to the rest of your body, which it is. Then I'm going to check your temperature to see if there's any moisture, which there are none. Next, I want you to take a deep breath. Great. I did not hear any wheezing or crackles. And your lungs expand symmetrically. There is no use of your accessory muscles. And next I'm going to listen to your lungs, which is 5 spots on each side. So I want you to keep breathing while I listen. Okay. I did not hear any wheezing or bronchi. Do you take a breast exam?
No.
Okay. Well, you will want to do that once a month. Preferably on your menstrual cycle during your 4th and 7th menstrual cycle. And you're going to want to do it while you're showering and while you're laying down, or whenever it's comfortable for you. And so the process to check for doing the breast examination is you're going to want to put your hand behind your head. Start at your axillary and spiral your way down. If you feel any bumps or lesions towards your nipple. And then you're going to want to squeeze your nipple and see for any discharge. And if you feel any lesions, tenderness, discharge, contact your doctor as soon as possible. Okay, now I'm going to check your left chest for any pulsations. So I'm just going to palpate your left chest. And there are no pulsations. And now I'm going to listen to all your valve sounds. And do you know where your heart is?
No.
It is in the second and fifth intercostal space in your sternum. So I'm going to use my stethoscope and I'm going to listen to all your valve sounds in your sternum. I want you to just keep breathing. I'm going to start on the right. This is your second intercostal space, which is the aortic valve. Now I'm going to start on your left, which is your second intercostal space, which is the pulmonic valve. Below that is in the third intercostal space, which is Irv's point. And below that is your fourth intercostal space, which is your tricuspid valve. And below that is your fifth intercostal space, which is your mitral valve. And, oh yeah, I'm going to listen on your fifth intercostal space and move on to your clavicle for any apical pulse. I didn't hear any murmurs or irregular rhythms, and everything sounds perfect. Now I'm going to go behind you and check and listen